Okay, Brandon Cross, date birth. Okay, I'm writing to agent refer Brandon into your care for assessment and management of his features suggestive of rheumatic fever. Okay, I'll take it, no problem. Today, Brandon reports in the clinic with no change in his symptoms of fever, tiredness, and joint pain. Furthermore, his ECG shows prolonged PR interval and laboratory report shows increased ESR and ASOT levels. Okay. I would prefer writing has showed, okay, because shows means it's a indefinite sentence. You are seeing his results and you are keep on looking at the results for the rest of your life. This is what the indefinite means, right? So I would prefer writing has to tell that you are writing in the present, but something which is done, which is completed. Okay, has showed would work in both ways. Okay, his ECG has showed and his reports has showed. On this date, Brendan reported in my clinic. Okay, there is no need to write in my clinic or some, just write reported with or presented with complaints of fever, sore throat, lethargy, and crying spells for 2 days. On examination, his temperature was 39.8 and his tonsils were enlarged along with enlarged cervical lymph nodes. He was given oral penicillin and paracetamol. Okay, he was given oral penicillin, paracetamol for 7 days as probable diagnosis of tonsillitis was made. He was asked for review after 5 days. Okay, so it's fine. See, there is no problem in merging your paragraphs. I have no issue with that. The problem is that you have already written a jumbo paragraph, right, about this much. Now, if you'll merge this paragraph again, so this is going to be even more. Okay, so this will not look good. Now, this is something, a mess. Okay, now there is I where the ending, where it's ending, it's not ending. There is no problem. See, guys, you have to be smart. When I said that you guys can merge, I'm not saying that you can merge everything in single paragraph, gigantic paragraph, and write 2.5 pages of one paragraph. No, don't do that, please. You have to be smart. If the paragraph is already this lengthy, try to manage. Okay, and try to write another. Okay, spare one line, write in another paragraph so that your letter looks good. If your letter looks good, it will be more better for you. Okay, these are the things that you have to understand for getting good score. Overall, till here, there is no problem with the letter writing. Everything is fine. Okay, but the problem is that that there is a mess here. Okay, don't do that. Okay, because if you'll not make things clear in the OET letter structure, if you go on and check the official website, they have said write or sorry, highlight the important information. How would you highlight the information? You can't just say that I will bring a yellow, what you say, something in yellow color or red color or a marker, okay, and I will just underline things to make it, possible for the examiner to see. That's not the case. This is not like ninth or 10th class exam that when we were doing these things, okay, so that we can get more scores in our board exams, right? This an OET. So how would you highlight? You will write information which is more readable to the reader, okay, so that he can give you scores. If you are written here, okay, now I can't even say that this is the subsequent visit is going to start from here. Okay, so whatever the information is in the subsequent visit, how would I predict? I can't. Okay, reader will not. They will not bother. I mean, why would they bother? You have already paid 1,25,000 rupees to them. They have no problem in failing you. They have all the rights, and you can't even say anything. Okay, how would you call them and say, okay, why you failed me? You can't say, right? So there should be no loophole, nothing from your side, okay? Because you have spent a lot of money, a lot of time. Okay, so these small things can cost you. So don't do that. Never ever make these mistakes. Okay. Overall letter is very well written till here. I have to read next, but this is the problem. Okay, I had to stop and tell you. Okay, on subsequent visit, his mother was concerned as Brendan was not eating well and he was complaining of fever, right knee joint pain, and lethargy. Okay, on examination, his temperature was this with hypertrophied tonsils, swollen knee joint, and on auscultation, mid systolic murmur was heard. His investigations requested were ECG, FBC, and ASOT. He was given Brufen and asked for review after 2 days with investigation reports. Okay. See, there is no problem with the writing. Everything is fine, well written. There's no problem. The problem is these jumbo things. Okay. And see, try to, minimize the word count. Okay. Try to, concise your letter a little bit. You cannot write each and every information that is given on the case notes. Just copy pasting won't work. You can write some same sentences. I have no problem with that, but try to, you know do some, try to do things in a little smart way so that you can concise. Okay, so sentences can improve a little bit. Overall, there is no problem. Simple, finely written sentences. Okay. Brendan is allergic to nuts as he uh, was hospitalized with an anaphylaxis 2 years ago following exposure to peanuts. Okay. In view of the above, be grateful. Okay, so overall, Dr. Sarah, I would say the letter is well written. The problem is that you have made a lot of mess, and I wouldn't recommend doing that again. Okay, and please send me a clear picture next time so that I can give you a good feedback. And please, all of you guys, don't think that you just have to send me a letter and have to assess, and it doesn't matter how will you send it. Okay, okay. So the good thing is, if you will practice in a way, the way you will write your exam, okay, like this much focus and this much intention, the chances of getting your scores are eventually going to be high because you are going to be very much focused while writing any letter. Okay. Because when you send me a letter, I'll check overall your presentation as well. See, now I cannot judge you on the basis of your presentation. Okay, so everything has scores. Okay, when you're writing something, they want you to write a formal letter. Okay, it is not something in which, like in childhood we used to give, some letters to our teachers. Okay, hanky panky letters. Okay, so these are not that letters. You have to write everything in a formal way. So it's better to write, in a very much better way, simple, clean letter. There should be no errors. If you are making errors, erase them. Write, try to write with the lead pencil, but the pencil should be sharp enough so that your letter should go in that way, and practice that. Okay, because if you're practicing with the blue or black pencil now, on the day of your exam, there are going to be some mistakes that are going to be made by you and you will be erasing. And because you will not have that enough practice, therefore what would you do? You might somehow, some of the words you might not be able to remove completely, or some you will be exhausted or you will be wasting your time. But if you practice in a way, things will improve. Okay, you will manage your time. Okay, so everything matters here. Then let's see Dr. Kajal's letter.